Hi, so second update on my brain tumour. For the past week, I have had different scans and tests again. I started with the CT scan on Monday, and then yesterday I had my eyes and my peripheral vision checked. Luckily, there is nothing wrong with my peripheral vision, and I in fact was told I have perfect vision, so quite happy about that. And luckily, my tumour isn't touching any of my optic nerves or anything like that either. The specialist in Leeds took a look at both my CT scan and my MRI scan on Wednesday, and yesterday with the specialist I was told it's not what we were originally led to believe it was. When I first got my diagnosis, I was told that it was a tumour inside the middle of my brain, and it's not. It is a very rare type of tumour that only 1 in 10,000 people will get, and I had to be the 1 in 10,000 to get it. It's actually formed at the base of my skull, and it has grown and grown and grown, and it's a very complicated tumour. It has a very odd name that I don't remember. um, Chances are that it is not malignant, although we can't rule it out, which I understand, but it still gives me a bit of hope and a little bit more comfort in knowing that for all it's not inside my brain, which we were originally led to believe, it is in fact pushing against my brain. The left side of my brain is flat like this, and the right side is being pushed up and making an arch over the tumour that we was told is in fact about the size of an orange. Luckily, however, the sort of site that the tumour is, which we were originally told was different, is a lot better. There is a higher chance that I will be able to get a biopsy to it, which will help us find out for definite whether or not it is malignant or benign, and the chances are where it is that surgery could be, well, surgery is a lot more possible than what it would have been if it was where they originally told it was. We don't really have any more information other than that, other than the fact that we will get an appointment towards Leeds Hospital at some point to see the young cancer specialist, a cancer specialist, a surgeon, and a neurology surgeon to overlook my scans and give me more tests and and hopefully a biopsy and everything else. I'd just like to thank everyone who's sent me messages and sort of let me know that they're there for me and that they're thinking of me, and it means a lot, and it is so humbling to think that there are so many people thinking of that. Matty, I don't really know if I should, well, he's my boyfriend. His mother goes to church, and she had the church pray for me, which is really touching, and I hope that people who are watching this will, if they have suffering through the same things, will again be able to understand this. And as I said, if it is something that you're going through, the chances of you having the same tumour of me are very little, because it is 1 in every 10,000. If there is any questions that anyone wants to ask, please comment on below, or if you have me on Facebook and then this is where you're seeing it, then send me a personal message and I'll be happy to answer it as best as I can. Thank you for watching, and hopefully there'll be an update within the next week, maybe 2, and hopefully we'll have more information. Bye.